Hello, everybody. Thank you very much for being with us today. We are very happy you are joining for this testimonial. And we are very happy that we have an interview today with Dr. Lanneluc from France. Her hospital is near to Paris. And we will have a very interesting discussion, I'm very sure, on how Unity Real-Time can help a laboratory in optimizing their efficiency and workflows.
So I'm Hortense Lanneluc. I'm a biologist. I work in Saint-Denis Hospital in France, near Paris, and I've been working there since 7 years. I'm responsible of mainly the biochemistry on our technical platform in our laboratory. I'm also responsible of the monitoring of Unity Real-Time for our QC.
Dr. Lanneluc, to give the viewers a little bit of perspective on which platforms you are using currently and you were using in the past, could you share with us a little bit the history on which platforms you were using and are using today?
Before we used the Architect from Abbott on our technical platform. Now we have replaced them with Alinity, still from Abbott, but it's the next generation of instrument, and we use it with the Bio-Rad control.
What is the main interest of using Unity Real-Time in your daily routine? Where does it help you?
So for me, the main advantage to use Unity Real-Time instead of other middleware is that you have a lot of advanced features to help you to follow your QC. On the same screen, you have access to your mean, the peer mean, but also our standard deviation, the Westguard rules, the analytical goals. You really have access to a lot of information, so it's really easy to review the QC every day.
With Unity Real-Time, do you think you gain time in using the software, or is it not really a timing issue?
Unity Real-Time helps us to be more efficient with our instruments because we can quickly check if everything is okay after a calibration, after a maintenance. We can quickly check that our instrument is working correctly, and then we can go back to do the routine tests. You have already all the data to program our total allowable error, to program our analytical goals. We don't have to do an impact study every time that QC trigger a Westguard rule for all the samples that were passed since the last correct QC. We only do the impact study for the patient and the samples when the QC is out of the analytical goals. So that also allows us to be more efficient. Since we have every information very quickly on our review screen, it's very fast. The fastest we review the QC, the fastest we can put our instruments online on the track, and we can start working for the patients.
Do you see the software as your companion helping you for your day-to-day job?
Yes. Yes, because we use it every day. At all times, we use it in the morning, we use it after our instrument maintenance, we use it on the afternoon to check all day that everything is okay. So when I arrive in the lab, we already had Unity Real-Time, but it was just for the inter-laboratory comparison. It wasn't used for the daily routine for the QC review. But when we pass directly from QC review on the instrument, which is not very good, to the Rolls-Royce of the QC review, so it was a shock.
Which are the persons or the roles in the laboratory who have access to the Unity Real-Time? Is it only you or also other people?
Almost everyone has access to Unity Real-Time. At the beginning, we first used Unity Real-Time for our main chemistry system to learn how to use it. Then, as soon as we felt more comfortable with the software, we started to use it for other parts of the lab. For example, now we use it for infectious serology. We also use it for immunology with capillary electrophoresis, for example. We recently started to use it with molecular biology, and now we plan to try to use it for hemostasis. But every day, everyone uses it. It's very simple to use. You really need a solid training to know and to know how to use all the features that it provides. Unity Real-Time is a really flexible software. You have the basic features for the daily routine, and you also have more advanced features for the middle and long-term follow-up of our QC.
We hear a lot about interlaboratory comparison. What's for you the main advantage for the interlaboratory comparison? Where does it help you?
When we review our QC, we can see on the same screen our data and the peer data. So we can check every day that we are still comparable with our peer. But we also have a report every month where we can check the trueness and the reliability with our peer.
One important thing that is happening, and I suppose it's also happened to you, is the accreditation process. Where does Unity Real-Time helps you for the accreditation process?
So Unity Real-Time is really useful during the audits because we have a full traceability of every action that were made. We have traceability for the technician review, for the biologist review. We can put the corrective action. We can see directly which lot number was used to pass the QC. Unity Real-Time is also helpful for all the monthly reports we have to do because the accreditation wants us to follow our QC every day, but also we need to have a middle term review and long term review. So with all the features that provides Unity Real-Time, we can show them, for example, the interlaboratory comparison. We also show them the rejection rate because it's also a good indicator that our machine works correctly. With the data grid, we have the possibility to compare our instruments in mirror. So every month we edit a report to check that on our two instruments in mirror we have the same results for the QC. So we are sure that if a patient passed on one or the other one instrument, we have the same result.
Dr. Lanouk, I know you are using Unity Real-Time already for almost 7 years or more than 7 years. What would be for you the added value in general by using Unity Real-Time? Where does it bring you the added value and where does it help you?
So in my opinion, with Unity Real-Time, we save time. We also feel more safe, more comfortable. We have the feeling that we can have a better control on our instruments.
We see, of course, quality control if you compare it to 40, 30 years ago and the evolution we made on the types of analytes. What will be the next step, in your opinion? What would make your life even more comfortable from a quality control perspective?
So for us, the next step is to use the IntelliQ controller. So it's load and go tubes, so they can allow us to avoid mistakes from the technician when they load the CQ. And it will also help us to have less dead volume when we pause our QC every day.
So, Dr. Lanouk, thank you very much for being with us today. We really appreciated all the background and information you shared with us. So I'm very sure that a lot of viewers online will be very interested on hearing your experience on Unity Real-Time. So thank you very much for being with us today, and hopefully we can meet at another occasion live in your laboratory. Thank you.